Dr. Hankinwei is an assistant professor in the Emory University School of Medicine, and she holds adjunct appointments at both the Emory School of Nursing and the Emory University Rollins School of Public Health. She also leads a large-scale HIV testing and linkage to care program in the Grady Health System Emergency Department, and her talk will be about emergency medicine, a new frontier in the battle against HIV.
Thank you very much. Thank you all for being here, and thank you for the opportunity to speak. I'm going to talk about emergency medicine, a new battleground, a new frontier in the battleground against HIV. The problem we're going to speak about today is that 19 million people worldwide who are living with HIV do not know their status. And the solution I propose is to integrate HIV testing into emergency medical care across the globe. So here we are on a beautiful day in Atlanta, but not even a mile from here. The emergency department where I teach and where I work clinically resembles in many ways emergency departments across the world. Patients who come to our public emergency department in inner city Atlanta often are quite poor. They may lack medical literacy. They may lack access to a physician or insurance. In these circumstances across the world is what leads people to access emergency medicine, often waiting even at Grady for up to 12 hours to see a physician. We know that these circumstances, poverty, lack of education, lack of access to resources, low health literacy, they overlap with risk factors for HIV transmission. This map of HIV in Atlanta demonstrates that overlap. As you can see, quickly to orient you, the light yellow areas are up to 100 people with HIV per 100,000. The dark purple areas towards the middle, which kind of at the center of which is where we are right now and where Grady Hospital is, those are upwards of 6,000 per 100,000 as much as 8,000 per 100,000 in some zip codes, and actually far higher when you zoom in on certain demographics. To put that in a global context, 8,000 per 100,000 population puts us similar to the population of Uganda as far as HIV prevalence, and actually far higher prevalence than many countries in the world. Knowing about the overlap between risk of being a patient at a public emergency department and the risk for HIV, in the summer of 2013, we instituted a routine HIV testing program in the Grady Emergency Department and Primary Care Center. We know that testing and treating are actually a model for eradicating HIV. This has been shown in certain populations and computer modeling globally. As people are diagnosed, just the act of diagnosing someone changes their behavior such that they're less likely to engage in behaviors that put them at risk for transmitting HIV. But diagnosing them and getting them on medication actually can bring the viral level in their blood down to nearly zero, so that even if they slip up and do engage in those behaviors, then they're a 96% reduced chance of transmitting HIV. In our program at Grady, over just under 21 months, we tested 37,000 people. Among those, we've identified over 300 people who are verified new positive diagnoses, and nearly half of those patients have AIDS on the day we diagnose them. So a healthy individual has a CD4 cell count of about 1,000. To get a diagnosis of AIDS, you have to have a count below 200. That takes about 8 or 10 years of infection. It's not uncommon for us to diagnose people and find out that their CD4 count is about 20. And we've had one patient whose CD4 count on the day of diagnosis was 2. Of those patients, 216 are already linked to care. That means they've seen a provider who has prescribed their HIV medication. And the rest we are actively working with to get into care. We are part, and Dr. Moreno, who spoke earlier, are part of FOCUS, collaboration worldwide, which is a public-private partnership with Gilead Sciences. And we are in 16 cities, 107 sites, who have done 1.65 million tests. So these are different sites with different cultural challenges and different even governmental challenges, but they're succeeding in doing what needs to be done, which is identifying people and getting them in care. Reaching the undiagnosed is critical. Each of these patients is somebody's parent, is a worker who's economically productive, is a person who hopes to be a grandparent and watch their kids graduate from school, is somebody with a future that we can connect them to through testing and treatment. I'm actually going to spend about 60 seconds, if I can, showing a video of the remarkable impact that just getting onto care can make. Okay, I'm going to skip that, but sorry. There's a short video, but essentially this patient on the left is the same person as the patient on the right. What separates these two people is 90 days of antiretroviral treatment. If you think about that and the impact that we've made through our emergency department testing program, you can imagine that these 300 people are not just numbers. Their lives, their economic impact, their impact on their family, their impact for their kids. But then if you take that and extrapolate that, what happens if every emergency department in Atlanta is doing routine testing? What happens if every emergency department in the country is doing routine testing? What happens if every emergency department across the world is doing routine testing? Then we're actually changing the world. We're saving lives every day. So back to the problem. 19 million people living across the world do not know their HIV status. And the solution is to integrate HIV testing into emergency medical care across the globe. Global emergency medicine is a science of meeting people when they need help and providing them the right care at the right time. Providing health systems in disasters or even in day-to-day personal disaster situations. It's the moment when a patient says to somebody, "I need help. Can you help me, doctor?" And that doctor can provide not only quality care, but a one simple test that can save their lives and secure their family's future. Together, we can do this. Thank you.